Hi class, this is the second part of the lecture for diseases of the digestive system. In this lecture, we'll be looking at different types of diarrhea. We'll also briefly look at the different diagnostic tests used in GI diseases. In a recent article, it was reported that more Americans are dying from suicide, drug use, and diarrhea. I think we've heard of increasing suicide and drug use in the US, but diarrhea? The article says that out of all the major infectious diseases, diarrheal diseases were the only cause of mortality that increased from year 2000 to 2014. It's further explained that this increase in diarrhea is not from food poisoning. It's from C. difficile, a bacteria that can cause life-threatening intestinal issues, especially among older patients taking antibiotics. So, what is diarrhea? Different people may have different definitions of diarrhea depending on their normal bowel habits. What is normal for some may not be normal for others. But for everyone to be on the same page, we need a standard definition of diarrhea. And so, the definition of diarrhea is 3 or more watery or loose bowel movements in a 24-hour period. Diarrhea can be classified by the duration and whether or not blood is present in the stools. So there is acute watery diarrhea, dysentery or acute bloody diarrhea, and chronic diarrhea if the diarrhea lasts for 14 days or more. There's also diarrhea due to lactose intolerance, but it will not be discussed in this lecture. Diarrhea is caused by irritation of the intestinal tract, which could be due to irritants or toxins. This leads to an increase in secretory products by the intestines, such as mucus, and an increase in intestinal motility, meaning the intestines move the contents at a faster rate. This means there is less time for water and electrolytes to be absorbed by the colon. As a result, a large amount of water and electrolytes is lost in the stool. Since a lot of water and electrolytes are lost through diarrhea, severe diarrhea can cause complications such as electrolyte irregularities, dehydration, and even death from hypovolemic shock if the person is overly dehydrated. The most common type of diarrhea is acute watery diarrhea. It is also known as gastroenteritis or stomach flu. Acute watery diarrhea is most commonly caused by viruses such as norovirus and rotavirus. It can also be caused by certain types of bacteria, example E. coli. Diarrhea caused by protozoa usually lasts for a longer time, so it causes chronic diarrhea rather than acute diarrhea. Diarrhea can also be caused by food poisoning. Sometimes, even if the contaminated food is cooked, the bacteria may be destroyed, but the toxins produced by the bacteria may still be present in the food and cause food poisoning. Acute watery diarrhea starts suddenly and lasts for a short while, usually around 24 to 48 hours. The condition is self-limiting, meaning that patients will get better even without treatment. Infectious diarrhea is always transmitted through the fecal-oral route, meaning a person eats food that is contaminated with human or animal feces. This can happen when a food worker uses the bathroom, then handles food without washing their hands, or the water that is used in the food may have been contaminated with raw sewage. A person with acute watery diarrhea will experience watery stools that resolve within 72 hours, abdominal cramps, flatulence, meaning excessive gas, nausea and vomiting, weakness and malaise, which is a general feeling of discomfort or illness, and fever. Since acute watery diarrhea resolves by itself, no antiviral or antibiotic treatment is needed. The aim of treatment is to prevent dehydration and relieve symptoms. To prevent dehydration, you can get oral rehydration salts from the pharmacy to dissolve in water and drink. Otherwise, the patient can just drink plenty of fluids such as water, fruit juice, etc. Some food and drinks can worsen diarrhea such as sugary drinks and milk, so this should be avoided. To reduce the frequency of diarrhea, anti-motility agents are available such as loperamide and diphenoxylate. Adsorbents are also used in the treatment of diarrhea such as kaolin pectin and activated charcoal. The idea is that hopefully the toxic substances in the gut will be adsorbed onto the kaolin or charcoal. Who are the people who get diarrhea? Very often people get diarrhea when they travel to another country that has a lower standard of hygiene compared to their home country. This is known as traveler's diarrhea. The cause of traveler's diarrhea may vary. A person can be infected by bacteria, viruses, or protozoa from the contaminated food and water that they consume. Depending on the cause of the diarrhea, the duration can vary. Viral diarrhea usually heals the fastest. It only lasts for 2 to 3 days. Bacterial diarrhea takes a longer time, around 3 to 7 days. And protozoal diarrhea lasts the longest. It can last for weeks to months if left untreated. Now we look at acute bloody diarrhea, which is also known as dysentery. In dysentery, the stool is mixed with blood and mucus. Dysentery can be caused by bacteria or protozoal infection. The most common causes are Entamoeba histolytica, which is a protozoa, and Shigella, which is a bacteria. In dysentery, besides experiencing diarrhea which contains blood and mucus, the patient also suffers from abdominal pain and fever. Dysentery can be treated with antibiotics if it is caused by bacteria or amebicides if it is caused by amoeba. If diarrhea lasts for more than 2 to 4 weeks, it is known as chronic diarrhea. Chronic diarrhea can have a wide range of causes. Irritable bowel syndrome is the most common cause. IBS causes abdominal cramps and altered bowel habits, which can be either diarrhea or constipation. Inflammatory bowel disease causes severe inflammation of the intestines. Crohn's disease and ulcerative colitis are the two main types of inflammatory bowel disease. Malabsorption syndrome, where the small intestine is unable to absorb nutrients properly, also leads to diarrhea because the nutrients remain in the intestine instead of getting absorbed. Chronic intestinal infections, especially protozoal infections, can cause chronic diarrhea. Colon cancer can also cause changes in bowel habits, which can be either diarrhea or constipation. Some medications can cause diarrhea as a side effect. And sometimes diarrhea can be self-inflicted. Sometimes a person who wants to slim down may abuse over-the-counter laxatives because they believe that the laxatives will prevent food from getting absorbed. But in fact, by the time the food reaches the large intestine, most of the calories have already been absorbed by the small intestine, so they are just losing mainly water and electrolytes from their system. Earlier, we saw that inflammatory bowel disease, or IBD, is one of the causes of chronic diarrhea. Initially, the signs and symptoms of IBD are similar to diarrhea due to bacterial or protozoal infection. That's because the patient experiences abdominal cramps, bloody diarrhea, and fever. But, unlike bacterial or protozoal diarrhea, IBD is not infectious. The cause of IBD is not entirely understood, but we know that the immune system produces an inflammatory reaction to the normal intestinal microflora. To distinguish between bacterial diarrhea and IBD, a stool culture can be done. For IBD, the stool culture will not show bacterial infection. Now that we've looked at the different diseases of the GI tract, let's take a look at some of the diagnostic procedures for these diseases. Diseases in the upper GI tract can be evaluated using endoscopy. Endoscopy here refers to esophago-gastro-duodenoscopy, or OGD. For this procedure, a flexible tube carrying a camera is inserted through the mouth into the GI tract. From the name, we can see that it can be used to visualize the esophagus, stomach, and duodenum. A barium X-ray is a procedure where a patient drinks a suspension of barium sulfate, which allows the stomach to be visualized clearly on an X-ray. Therefore, it can be used to evaluate abnormalities in the stomach, such as peptic ulcers. To evaluate diarrhea, a stool culture can be used to look for pathogenic bacteria. Only bacteria will grow on a culture plate. Viruses will not show a positive stool culture. A thorough history of where the patient has been and what they have been eating is also important. The next two videos will show you an endoscopy and a colonoscopy. For endoscopy, the camera is inserted through the mouth and reaches the esophagus, stomach, and duodenum. For colonoscopy, the camera is inserted through the anus and is used to visualize the colon. You will be able to see the insides of the gastrointestinal tract, so click on the videos to watch them. That's the end of part 2. We have covered diarrhea and some diagnostic procedures involving the GI tract in this lecture. Check out the videos of endoscopy and colonoscopy. Then in part 3, which is the last part of this lecture, we will look at diseases affecting the liver.